Hello, good afternoon, everybody. So we shall start with our webinar. Good afternoon, ladies and gentlemen. Thank you for joining the webinar today. My name is Haslam. I'm a senior EHS consultant with Enviro Solutions and Consulting. I have over 12 years of quality, health, safety, and environment management locally and regionally. With me today, I have my colleagues, Ashri and Richard, who will be glad to share the safe management measures.
Hi, I'm Ashri. Right, I'm a EHS consultant. I've been a WHO for the past few years, with a total of almost 18 years of EHS experience, right, both in Singapore, Ireland, and also regional wise. Right, over to Richard.
Hi everyone, so my name's Rich. I work for the Blue Kango team for ESC. I've been working now in environmental regulations, health and safety for about 8 years, and towards the end of the webinar I'm going to talk about the digitalization of EHS management systems.
Thank you, Ashri and Richard. Now I would like to start off with an introduction of Singapore Circuit Breaker, which will be ending soon. As you can see, by the 2nd of June, we will enter phase 1, which will last for at least 4 weeks. This means some businesses can start opening, after which we will go into phase 2, which can last over a few months. In phase 2, sports, recreational, and outdoor facilities such as gyms, fitness studios, even retail outlets, tuition and enrichment centers, food and beverage dine-in will reopen with safe management practice. And lastly, we will enter phase 3, which is the new normal, until a vaccine is available, where social, cultural, religious, and business gatherings or events would resume with limited crowd size. The topics to be shared today will be the 6 pointers as follows. The 6 pointers will be appointment of safe monitoring officers, reduce physical interaction, support contact tracing requirements, PPE and personal hygiene, ensure cleanliness at workplace, health checks and protocols to manage potential cases. Before continuing, I would like you to answer a quick poll with regards to safe management measures. It will take a quick 2 minutes and I will share the results immediately. So I will give another 2 minutes for attendees to complete the poll. So I will give another 1 minute for those who have not completed the poll. Thirty more seconds to go for those who have not completed the poll. Ten more seconds. Okay, thank you very much. For those of you who have completed the poll, I can see a good number that I will share with you quickly. Are our people and systems ready for our workplace to open after the circuit breaker? Well, most of the attendees have answered yes, and I believe with yes, that means you have systems in place, you have people in place to manage the workplace. Well, for the benefit of 23% who have answered no, we will continue with our presentation as follows. The SMM details will be further elaborated by Ashri. Ashri, please.
Yes, thank you, Aslam. Right. Most of you understand that we need to have SMM, which is safe measurements monitoring within the workplace itself. Right. So, who is supposed to do it? The person supposed to do it is actually the safe monitoring officers. Right. These officers will actually ensure that all the safe measurements are in place. Right. They are supposed to do inspections of the workplace. They're supposed to ensure that everybody follows the guidelines that has been stated by the government. Not only that, they are supposed to also keep records of all their inspections, all the remedial actions, and keep it for at least 28 days. The SMM, right, is a very important document within the workplace. It also will state about your working hours, how you're going to spend your time at work, how you're going to commute to work, your break hours, whether it's going to be standard or it's going to be flexible, right? All this will be inside your SMM. Then it also will state about your safe distancing within the workplace. Safe distancing, 1 meter apart from each other. Seats which are already been marked are not supposed to be seated actually. So let's say, right, I return back to the office and I see that there are seats which are not marked. Okay, am I allowed to sit on them? The answer will be, as long as you keep a social distancing of 1 meter from each other, you're allowed to sit if your table is large enough. But if your tables are those small open tables, you are actually supposed to have it marked that a gap of 1 meter at least must be there between from one person to another person. Then what about meetings? Meeting rooms will also be the same, right? There we have marks on the table, on the chairs that you're not supposed to sit. Apart from that, meetings, if you are able to conduct it virtually, do it virtually, right? But if, let's say, the meetings require physical meetups, like signing of contract and all that, yes, the safe distancing measures have to be followed. So, deliveries also has to follow the same method, whereby you try for minimize contact between one another person during your deliveries. Okay, so now the question is, if my workplace, right, is it okay to open or not okay to open? Well, it actually depends. If you fall into the criteria that you're allowed to open, yes, you are allowed to open with all these measures in place. But if, let's say, you don't have these measures in place, you may be liable to be fined by the authorities. Okay, so how do you ensure that people who come to the office or come to see you actually follow the government requirements? Well, there are a few things by the government. One is actually the Trace Together app, right? The Trace Together app must be turned on at all times, right? When the SMO gets a person, he is actually to check whether the person has turned on the Bluetooth tracking for the Trace Together app. And also, there's another app, there's another QR code which the person has to scan before he enters the place, which is the safe entry. the safe entry requirement by the government, right, whereby companies need to apply with MTI, right, to get the QR code from them, right, and display it at their workplace so that the people can scan, and people are allowed, and people must show that they have scanned, that they already entered the place, and when they finish, they are supposed to scan out, right? So with safe entry, let's say the safe entry, I'm entering a building. The building has a safe entry code. Do I still need to scan the safe entry again for the office? Once the office has received the QR code from the MTI, yes, you still need to scan. That's just telling the government that, hey, I am here, right, from this time to this time. These are all for contact tracing purposes, right? So now the SMO, does his job end there? It does not. The SMO must ensure that employees, visitors, whoever is within the vicinity has to have the proper PPE. When we talk about construction industry, PPE, this helmet, safety shoes, safety glasses, all that. But are you going to wear them inside the office? Obviously not, right? What you're going to wear is actually the mask, right? A mask is actually recommended the moment that you step out of your house. So when you take a public transport and you walk around, you're required to actually wear a mask. There'll be safe distancing officers who will tell you, please put on your mask, right? So even in the office, it is recommended, and you must have to follow that a mask is required inside. So what type of mask? The government has just issued the second phase of mask, right? For Singapore citizens and PR, you can actually collect them from a CC near you. Then we will talk about other duties, which is to ensure cleanliness. So does the SMO need to clean the whole office before anybody comes in? Obviously, it's not his duty to clean, right? But the cleaning custodian, right, has to clean the work area. The SMO's duty is to ensure that the custodian does their work, right? Whereby after each meeting, somebody cleans up the area. End of the day, somebody cleans up the area using guidelines from NEA for cleaning disinfectants, right? The SMO has to ensure that, oh, they are using this disinfectant. Okay, this is in guidelines with NEA, right? So he has to ensure that everything is within the SMM document, right? Then, now, let's say you have a common toilet. Does the SMO have to take care of the common toilet? That means it's been shared with other tenants. Does the SMO have to take care of that too? Well, each building, I'm sure they will have their own SMOs who will actually cater to that. But within your own office, within your own company, you are actually required to ensure that cleaning process is being done. Not only for normal days, but also for cases, right? We will go into that in a few minutes. All right. So what items need to be cleaned in the office? General cleaning includes of your workspace, work areas, tables, high touch areas, right? These are all general cleaning areas, right? So these are areas which the SMO has to actually take note of, have a checklist, say, oh, this person has done, right? They have done the cleaning, take it. They've done on this date, this time, take, right? So now what do you do if somebody is a suspect or a confirmed case? Okay, suspect and confirmed case are two different things. Confirmed cases, as a SMO, even as an employer, I do not say that my employee is a confirmed case. You are a confirmed case, you don't come to work. No, right? Who has the authority to tell the person that they have the confirmed case is actually the hospitals themselves after they've gone through the swab test, right? So once a person has gone through a swab test, they have actually been confirmed to have COVID-19, right? The hospital will take action, okay, to do contact tracing, to inform the patient that, hey, you are a confirmed case, please contact your workplaces, right, or your family members. So a suspect case is when a person develops symptoms of COVID-19, like high fever, loss of appetite, loss of sensories, right? So these are suspected cases. If a person comes up to you, sorry, I'm not feeling well. My temperature is 38 at the moment, right? So these are suspected cases whereby you actually have to have a plan what you're supposed to do. So for one of my companies that I'm taking care of, we have a plan whereby we take the suspected person into an isolation area. We ensure that he cleans himself, which is using either by washing his hands or by sanitizing himself. Put on a mask, right? Usually, if it's a disposable mask that he's putting on, we give him a new one, right? So that the old one gets discarded. Okay, and at the same time, we ensure that he goes and see a doctor. So which doctor does he need to go? If you go to the app Flu Go Where, it will tell you the nearest PHPC clinic. So for your SMM document, do state which clinics are near the vicinity of your company, so that it's a one-time. Once you open it, oh, you can go to this clinic. This is the nearest clinic which can go, right? Because the reason is to reduce the outdoor exposure of the person. That means we do not want the person to take the MRT from, if his office in Bedok, he goes to Jurong West because he stays there to see a doctor, right? Whereby if he goes to a clinic near the office in Bedok, right, if something goes wrong, actually he gets treatment faster. The old saying is, oh, my records are in NUH. I'm working in Bedok. The doctor sent me to CGH. So would there be a problem? There's no problem, actually. One thing is, do not worry, because all our medical records are all linked together, right? There's a government link for the doctors to share all these items between one another, right? So in the event that you have a suspected case, number one, isolate the person, ensure the person see a doctor, then ensure that the area where he works is clean. Clean up his area thoroughly, then follow up with the person whether he has been sent to NCID for any further checks and all that. So let's say if it's a confirmed case, the office is recommended to actually shut down for a thorough cleaning, right? So if it's just a suspected case, there's no confirmation, you just have to clean the work area, workspace. But if it's a confirmed case, yes, you need to thoroughly clean the whole area and ensure that all other staffs check in with you that I'm feeling okay for the next 2 weeks, right? This is to ensure that there's nobody else who actually has the virus. Okay, so in the event of a confirmed case, your company will actually go back to working at home, basically to the circuit breaker period again. During that period, right, the SMM job still does not end there, because the cleaning custodian will still be there. The cleaning custodian will still ensure that deep cleaning has been done. So who can do the deep cleaning? NEA has a list of all the contractors who can do the deep cleaning itself. So do look into the NEA website, right? It will tell you more of who the people will do, right? So right now, with all the inspections that the SMO has to do, with all the paperwork that SMO has to do, with all the checks that they are supposed to do you think there'd be a simpler way for him to do it? right? For this, I need to ask Richard. Richard, do you think we have a simpler way to do all this? Because it will create tons of paperwork for all of us, right, Richard?
You know what? I think I might have a simpler way. Yes, we didn't practice this, but yes. So what I'm going to talk about is how you can use safe management measures management platform, which is basically digitizing your paper forms to help you manage all of the extra administrative burden that basically Azuri's just gone through. So you can see the 6 points. There's several areas in those sections which are going to probably be quite a bit of a headache, whether you're already doing some daily inspections, like most companies probably are, implemented something already. You're going to have to be adapting those checklists. You're going to have to be appointing new staff members and training them to carry out these additional checks. So what you might be able to benefit from is a cloud-based EHS management platform, which is something that the ESC can actually deliver to you. So I'll just go through some of the main benefits of the platform. One of the main aspects is actually in implementing the monitoring plan. So what we're talking about here is the daily inspections, the spot checks that you have to carry out every day, and the safe management officers will have to undertake. And we need to make sure that the office is safe for everyone, but also we don't want any problems with the authorities. For example, if you know, in the unfortunate event that there is a confirmed case coming out of the office, we need to be able to show that we carried out all of the necessary inspections and did our best to try and prevent COVID from affecting our workplace. So what we can use is a tablet or a phone with a built-in checklist, and we can go around and do easily do all of the checklists every day, and we'll keep a record there. As soon as we input the information, it will create a record in the platform, and this is the key to it, which is one of the benefits of the management platform over the paper-based system, is that you can easily retrieve records. So you can imagine if there was a spot check or if something went wrong, people will be running around like headless chickens looking for records and thinking, oh, did we do enough? Or can we prove that we were implementing these measures? If you've got the platform, you'll have everything saved there automatically, and you can easily go in and retrieve it. I think that is one of the main benefits of having a platform. Secondly, is we're getting a lot of interest at the moment in our permit to work systems, some of our management systems, because companies are looking at ways to reduce physical interactions. So if you're on the construction site, you need to be going around, walking around with paperwork, getting it signed. Every time you go to somebody or bring them to you to sign the paperwork, that's an interaction that could be avoided if you had a digital form or to do it on the tablet, and instead of using paper-based, you're using an e-signature. So that's just one example of how a platform can reduce physical interactions and then obviously reduces risk. If you do find something wrong, for example, on your monitoring plan, or there is a confirmed case and you need to then implement the next stage of your plan, you can actually automate this using the management platform. So you can create real-time corrective actions. And what that means is, as soon as I realize something's wrong when I'm doing my inspection, I observe a non-compliance, I can trigger a series of events in the platform, which can then inform other people in the organization that they need to do certain tasks. And so it creates an automation to a system that could potentially is very important and could go wrong if you're leaving it to human error. So who do I ring if someone is confirmed case, or what if there is a non-compliance for the monitoring plan? If you're using a platform, you can actually automate all of those responses within the platform and notify the right people. For the next section, it is one of the areas I think, if I was doing the SMO job, would be the thing that would worry me the most, is keeping track of the HR. So what I mean by that is, who are the people who should be coming to the office? Is there anybody who's on a stay-at-home notice? And we need to know those dates of those people. As the phases change, maybe some workers will be coming back from overseas. Do they need to be staying at home and quarantining? So we need to have a really good understanding of who should be and who shouldn't be at the office. And I think this is where you automate that, and you've got triggers and reminders which relate to when the people should be allowed to come back. If you've got a platform to help you with that, it's going to definitely reduce the errors on that part. And an error on that side of things is definitely going to be a major error, I think, for the company. And if then there was an outbreak, it's it's going to be quite troublesome, I think, to explain that. So you need to automate this and take away human error. And then finally, it's the benefit of the platform is also to give the senior management a really good overview of what's happening. So at the end of the day, their names are on the door of the company, and if anything goes wrong, they need to have made sure that they did everything they could, and all of the safe management officers were actually carrying out their duties. And with the management platform, you can actually oversee that much more easily than you would if it was just a paper-based inspections, because every time an inspection is inputted into the system, you will get a trigger. You can see it was done that day. You can go, okay, that's great. That was no problem for that day. If there was something wrong, you will see that and you can be notified about it and then do the necessary corrective actions. And that's also creating an evidence trail as well. So you've got that all in the platform to show that you took necessary actions. Right. So, I mean, some people might be thinking, as we go through the phases, maybe the safe management measures will be phased out, and so why do I need to invest in a platform that I'll only use for, say, 4 to 6 months? And I can see the point for that. So what we're saying is, because our platform is actually subscription based, you can actually cancel anytime. So you might start using it and you see it's useful, and you might even see that you can put other checklists in there, other modules that would be useful outside of the safe management measures. So we'll be talking about management systems, your normal daily checklists can all be integrated into the system. And I think this is just potentially just a good time for companies to start thinking about digitization, because it's coming to the point in the end now where the benefits of it are so great that you may as well start thinking about implementing it, not just because of COVID, but just because of the benefits that it brings, sort of in a whole scale way rather than just focused on the virus. Right, so that's just some little ideas of how you can use an EHS management platform. And I'll go to some testimonials now, because obviously this has been going on for a few weeks or even months. So companies have started proactively looking at digitization. We've got one testimonial we did for a company in Canada, actually. And what they did is, as soon as they went back to work, they knew they had to implement some new measures. And the bosses and quality control guys especially wanted to have a better overview and to automate some of the inspections and the corrective actions. So they came to Blue Kango, and quickly there, you can see on the testimonial, after a few days, it doesn't take so long. You can put together a checklist, automate it, get the right people involved, the user access rights, and you can implement these systems very easily. And they really will improve your sharing of information between the different levels of the organization, and also your response times to potentially serious non-compliances and serious risks to the company. So at the moment, we're working with a lot of current clients as well to adapt their checklists to include new checklists and new audit functions, which are focused primarily on COVID-19 management. So this could be PPE checks, it can be extra monitoring, it could be cleaning checks. All of these things can be put into the system to help you monitor it. Right, finally, just a quick bit of information about the software. So it's been around about 20 years. It's over 3,200 clients, 1.3 million users logging in, and we've got all different industries using the Blue Kango software. And like I said before, if you're using it and you think you're not sure if you want to keep it on, there's always new modules you can add to the system as you go. It's a very versatile and easily adapted system. But if not, once you've used it, if it served its purpose for the COVID-19, you can actually just cancel your subscription. So it's very low risk, but it's going to be a really good benefit to you for managing COVID-19. Thanks a lot. I'll hand over back to you, Astrid.
Okay, thank you very much, Ashri and Richard. That's a good presentation. So we're going to have the Q&A right now. As we go along, please type in your questions so that Ashri, Richard, or even myself can answer them. You can type it in the chat box and then just send it over to us. There's a panel section there. I'll give it a good probably 2 minutes so that you can type in your questions. Okay, so I think the first question has already come in. It's from Mr. Imran. I think this question is for Ashri. For the SMM document, is it standard or unique for each company?
All right. To answer that, Imran. So the thing is, the title should be standard, right? Following the 6 items which are supposed to be there, and it's actually unique as in to the different industry, right? So let's say if you're handling for your office and for your construction site, right? So basically your head office and the construction site, you can actually combine them to ensure that you have just one document. But as an advice, just as an advice, what I did is actually to combine my SMM and also with my BCP, right? So these 2 documents can be combined, and exactly it's just as a follow-up to a BCP on what you're supposed to do and all that during your site works or during your office works, right? So I hope this answers it, whereby you can actually combine your SMM. Right.
Okay.
Aslam?
So thank you, Ashri. I have another question here by Mr. Raju. Which companies can open in phase 1?
That question should be for me, am I right? Okay,
Yeah.
so which companies can be open? Right, under the MTI guidelines, right? They are in accordance to your business entity business entity registration code. Right, that's the correct word, right? So whereby when you register a business, the business has a code, right? 7170, the starting numbers basically. So MTI has given that these few numbers are allowed to operate as of phase 1. Okay, so you need to check if your company falls under these codes, they are allowed to actually open. So examples, consultancy, you're allowed to open. F&B, you're allowed to open. Hair salons are to open, right? So these are some examples. If I'm not mistaken, bubble tea still closed, right?
Okay. Good. So thank you, Ashri. I have another question here by Mr. Abdul Halil. This question should be for Richard. IT security and confidentiality and subscription costs. This should be for BKG.
All right, so Blue Kango, we actually store the customer data on Microsoft Azure. So it's a secure link from the platform to Microsoft Azure, and then Microsoft Azure is handling all of security. So you can imagine with Microsoft, they have ISO 27001, so that includes all the physical security of the data center, but also all the digital security, so all of avoiding cyber attacks, penetration tests, 24/7 monitoring of the data. So yeah, you're in about the safest place really in terms of data security. Even sort of on a Singapore focus, they have some certifications which are being given by the government just for Microsoft Azure for storing government information. So I mean, there's no better place in terms of that. And the other part of the question was about the subscription, right?
Yes.
Yeah, so for subscription for Blue Kango, I'll just give you some ideas of ballpark. So it all depends on the complexity of the system, but really we're looking about $600 to $1,000 per month. And if it depends on how many modules, how many checklists, and how many sort of customizations you have to do to the forms and the complexity of it. But really, for a simple safe management measures platform with 4 or 5 modules, going to help you do monitoring, going to help you track your HR. You're looking at the lower end of the $600 to $700 per month. No problem. Yep.
Okay, thanks, Richard. I think that's there's a link to the first question. Can you show a sample format of the application?
You know what? I haven't got anything ready at the minute, but I can. You know, after this, we will send some information out to the people who are interested. You'll get a survey questions as well, and we'll provide you all the information. If you want a demonstration of it, we can do that. You know, next week or something. We can arrange that. Yeah.
Thanks. Thank you very much, Rich. So there's another question here with regards to SMM by Mr. Zulhairi. Can the appointed SMO perform his duty prior to completing his course? Ashri?
Right, that's a very good question. About courses for SMO. So far, the only authority which states that SMO needs to have certain training or prerequisites to be a SMO is actually BCA, right? So BCA has actually rolled out that you are required to go for training in order for you to be deemed as trained and competent as a SMO, right? But for the past few days, my chat groups and a lot of emails I received from training providers, which they are actually also running some similar courses. Okay, but the BCA one is specifically for construction, right? But for the rest, so far it has not been. There's no guideline for MOM say that it's mandatory for other businesses, but for construction, yes, it is still mandatory that SMO go for the training, right? I hope this answers you.
Thank you again, Ashri. There's another question for you, yeah, Ashri. Again by Mr. Imran. I know it's a hot topic about SMM, so yeah, we have lots of questions here.
SMM
I
and
apologize to participants, yeah. I apologize to all the participants if we cannot screen all the questions that you have sent to us, but we will surely reply to you via email. We'll contact you directly. Okay, the next question for SMM. What can company do if employee is reluctant to sign up for Trace Together?
Well, what can the company do if the employee is reluctant to sign up for Trace Together? Well, basically, Trace Together is a government initiative, right? Basically, you can't force them that they are supposed to have Trace Together. You can't force them, right? If they don't want, right? Because it's basically a social responsibility that you turn it on. It's a social responsibility, right? But however, you can deny them entry into the premise if they do not scan in the QR code for safe entry, right? But because it's your safety and safety of others within your facility or vicinity that uh, everybody scans the QR code to tell that they are there, right? And then when they go out, scan again, say, yes, I have left the area. Elvis has left the building, right? So safe entry, you can actually make use of safe entry for your vicinity actually, right? If they don't want to turn on the Trace Together app, which actually to me is good that you turn it on, right? As you are being traced and you know that who you are with, even if it's a total stranger beside you, right? So it's still good, right? Do advise basically that to turn it on at all times.
Thank you again, Ashri. And again for SMM question by Mr. Charles. Do you have more details on the vulnerable policy and measure we should do if a staff cannot work from home or change role? Are adding PPE sufficient to comply?
Basically, adding PPE is not sufficient, right? And if let's say the staff is basically going to be an essential worker that needs to come back to the office, right? So you actually need to have a table whereby all the staff names who are going to be within the office during this period, right? And actually submit them over to MPI. right? There's actually NTI guideline which you are actually supposed to follow for this kind of cases. Let's say I need to use a printer urgently, or I need to use a scanner urgently, or something is not right with my server in the office. I need to go down, right? So, and I'm not an essential worker. My name is not within the essential workforce list, right? So the company actually has to contact MTI and to get this employee names in, right? So basically, you still need to have a table of the employees that are within your vicinity, within your offices or work sites, right? And if they are not in the list, right, do check with MTI again, right? Because they would be the governing body for ensuring that the correct people are at the workplace, right?
Okay, thank you, Ashri. There's another question again for SMM by Mr. Karthik. Is the SMO required to be appointed in writing?
So let's say, Mr. Aslam, today I appoint you as MO,
Okay,
verbal. MOM knocks your door. Hello, hello. Excuse me, Mr. Aslam. Who is the SMO here?
I don't know.
I don't know. It's Mr. Richard. He goes to Mr. Richard. Mr. Richard, who's the SMO here? Oh, Mr. Ashri. Mr. Ashri, who's the SMO here? I told Mr. Aslam to be the SMO. So, what do you have in writing that states that he's an SMO? Does he have the relevant courses? Does he have the capacity to do it? So, to answer that, Mr. Kartik, yes, you need to appoint the person still, right? Okay, as an SMO. He still needs to have an appointment. What are his duties? You would ask me. His duties would be as what MOM has stated in their website. Okay, there's quite a number of there's a list actually of his duties to check the job site, ensure that safe distancing measures are in place, all the cleaning items are in place. So these are all his duties as a SMO, right? So Mr. Kartik, I hope that answers you that yes, you need to uh, have appointment letter for the SMO.
Okay, thank you, Ashri. Yeah, there's another question again for the SMM. I think we should have another about 5 minutes more before we end the call. So I'm trying to compile all the questions here. Does WICA covers accident happen to employees while working from home?
WICA covers accident of employees working from home. That's a good question, which actually uh, would be directed back to MOM, whereby actually, as long as you are contributing work to the company or hours to the company, and you are able to justify that, hey, this is my working period, right? Though I'm not traveling to work, but this is my working period. Okay, and the work related, let's say that you are doing work on office on your desk, okay, at home, and you slipped from the chair, you had a fall. So does that constitute to an incident or an accident? The answer would be as long as it is for the purpose of work, right? An investigation should be conducted on why and how the accident happened, right? And it's the process of your accident investigation still has to be done in order for you to actually claim for WICA. So uh, to answer that further, the best is to check with MOM for that, right? Whether the WICA insurance coverage covers that.
Yeah. Okay. Thanks again, Ashri. There's another question by Muhammad Suhaimi. Can I combine the SMM and COVID safe restart criteria?
Sorry, COVID?
Safe restart criteria.
SMM and COVID safe restart criteria. Well, actually, it's almost the same, whereby your COVID safe restart criteria, basically, and your SMM, as long as you fall, I mean, your company has to have a certain directive to follow, right? So in order to open safely, your company needs to have certain guidelines, right? So let's say if you're following guidelines of 1 meter spacing, right? Your company says, okay, no, let's have 2 meter spacing, right? So is it still in compliance? Yes. The thing is, there are the criteria is actually as a guideline, right? Whereby you can be more stringent, right? And you can actually combine it together in ensure that you actually it eases you, right? To monitor one document.
Okay, thank you, Ashri.
Can I
I
come in
think
on
this,
that as well?
yeah, sure, Rich.
I was thinking, so, you know, a lot of these measures, some of them, there isn't exactly the clear guideline, exactly what you need to do. But the principle is always that you should do as much as you can, right? And that's also could be to do with the, or involves the implementation of systems as well. So I think that a good step forward is also, you know, if you start looking at management platforms and things like that, you're showing you proactively trying to improve your systems and make the place safer for everyone. So that's something to consider as well, especially like, you know, capturing all your records and doing the monitoring. If you formalize all of that, and that's where a digital management system could come in place as well.
Yep, true. So
Right.
Richard, basically, what we see is the SMO will have a whole ton of paperwork, maybe a lot of paperwork, right? So basically, digitizing it does help to actually ease the pain of the person doing the SMO duties, sorry.
Yeah. Well, talking about SMO, I'm just going to read out the last three questions for today. I have one here by Mr. Teo. Does company need to deploy one or a few SMOs?
That's a good question. Whereby, let's say I'm the SMO, and the moment 2 days just after I started being an SMO in the office, I am down with COVID-19. So for the next period of all the way that I am not in the office, does that mean the SMO duty stop for the company? Basically, for that, it is wise to actually appoint a few persons so that there will be, some companies actually have shifts, right? Different shifts. Some companies have different days to come in, team A, team B, right? So it's wise to actually have a few SMOs within the company.
Okay, so thank you, Ashri. The second last question, this is for Richard by Mr. Smith. The SMM might be taken away after 6 months. Can I cancel if I subscribe to BKG after 6 months?
The answer to that is yes, but you know, the success rate and the sort of satisfaction rate for BKG is very high that most people probably wouldn't cancel, I think, because we're moving forward now, and this, I think that the COVID-19 is showing a lot of companies that they need to embrace digitization. So it would just be, you know, maybe now it's become very necessary to implement these things because of physical distancing rules and split shifts and everything. And I do see that there will be really a big reason to cancel, because you can always add on new modules and new functions onto these platforms. So yeah, the answer is yes, but I wouldn't expect that many people would even cancel after they've started using the system.
Okay, thank you, Richard. And last but not least, the last question for today is by Joseph. Is there a specific frequency of inspection for SMO? And this is for Ashri.
Right. Specific frequency for SMO. So far, they did say that daily inspections. Basically, is the daily inspection will be to look out for things which are not right. Okay, whereby it's more like you see that it's not right, you take a photo of it and you come up with an inspection report. These are the kind of daily items. So let's say if your cleaning person comes daily. So give them the checklist for cleaning, right? Get them to fill it up. Just check that, oh, they've done the cleaning, right? Just counter check. And basically it's just to ensure that your workplace, okay, is on a daily basis, that it has followed the safe measures, basically, right? So the best would be still, if you're going to be there daily, do it daily.
Okay, thank you, Ashri. So now we have come towards the end of our webinar. I would like to remind all the participants to fill out the survey form. For those questions that we are not able to answer, we will get back to you via email. So I would like to thank you, my colleagues, Richard and Ashri. Thank you very much for the good presentation. I would like to also thank the participant who has joined us and listened to the SMM sharing session with you. Hope to see you again. So feel free to contact us in ESC and have a good day ahead. Thank you.
Thank you.
All right, take care. Have a safe day.